for TRT to kick in? When does it work?
That's an interesting question. And at the end of the day, you have to consider a few factors. First and foremost, what are the symptoms that are being experienced as a result of the deficiency that we're presuming someone has when they get on TRT? What is their previous experience with androgen use? And are they currently on TRT or another form of a replacement therapy of hormones, and they're simply switching esters or administration form? So there's a few underlying variables that are going to possibly change the answer to that question. For the most part, we're going to assume, I guess, the most logical, which is a gentleman who's experiencing symptomatic low T lifestyle, and he comes in for help, and he's beginning for the first time with androgen therapy. And, again, it's going to come down to whether or not it's being administered with a transdermal, if it's being administered with an injectable, and if so, depending on the country they're in, what is the ester that is most commonly used or available. Shorter esters are going to kick on faster. They're also quicker to excrete, and they may require more frequent administration dosing. Longer esters, I know in some parts of, like Australia, I believe, they use some esters that are extremely long. I think Reardrin is one. I think there's which is an undecylonate. There is a couple of places around the world that use like 1,000 milligram, once every like 20-week injection. I'm not a big fan of trying, because this gets us back into that whole discussion of pellets, where it's like, let's give the guy a tremendous dose and track over 3 or 4 months. Everyone's rate of absorption, metabolism, and excretion is going to vary, and symptom resolution is going to vary depending on the symptoms and how the pharmacokinetics of the medication works. For the most part, and I can speak about what we do here in our clinics in the United States, we use cypionate for replacement therapy for the most part. And cypionate, as we know, depending on the individual and a few underlying factors like SHBG, nutrition, age, etc., tends to have a half-life of about 7 to 8 days in most men, which means that it takes that long for the medication to reach a state of 50% of what was initially administered a week before. And if we split that dose to a minimum of twice per week, we are assuming that we're not really going to drop below a 75% before re-upping that. So we're trying to achieve steady states. In pharmacodynamics, which discusses the effects and mechanism of action and essentially the excretion of medication or the half-life of medication, we know that it takes approximately 5 half-lives of any medication to achieve a steady state, assuming it is being administered with the correct frequency. So if we look at the half-life of cypionate, 7 to 8 days, we're going to assume 35 to 40 days just to build up a steady state. What does a steady state means? It means that you're no longer going up in terms of milligrams in your system, and you're no longer coming down. You've achieved the peak and you're stably staying at that peak. This does not mean that your serum levels or that your symptoms have reached a steady state, okay? What it means is simply that the medication has reached a steady state. There are various factors that take a very long time on hormones, and there are also other attributes that are going to contribute to this, like lifestyle and sleep and nutrition and whatnot, and genetics. But for the most part, let's take bone mineral density, which is one of the vast benefits of TRT, as we know, both from the estrogen conversion, which is a metabolite that takes a little longer, as well as testosterone itself. Bone mineral density can take 6 to 12 months before it actually peaks or starts to show up in DEXA scans as an improvement. The first sign that we see in patients beginning testosterone cypionate is usually an improvement in libido, as well as an overall sense of well-being. That means slightly less anxiety, maybe a better mood, or maybe a cessation to a level of depression or an improvement in that department. That tends to fluctuate again depending on the patient, but usually we can start to see that anywhere from, I would say, 2 weeks on the rapid side, and some of that may be some placebo effect, which is totally okay. It comes down to how the guy feels. But I would say by the 4 to 6 week mark, we tend to check in with guys and hear that, hey, my libido's better, I feel better. I have a better outlook on life and about going about my day, and I do feel better than I did a month ago. So I would say it's fairly rapid for something that is essentially a lifelong journey. It is fairly rapid to act. And the reason we wait, for the steady state is because we're seeking to see where you land. And then a couple of weeks later, we have them back in for labs. So that first, I would say, 8-week period is crucial in your dialing in process. Because if we think of the old style radios, they had a tuning button where you find the station, and then they had a fine tuning button. So first I find my station and I hear it, but there's some static. So then I play with the antenna, and some of the static goes away, but there's still a little bit of interference. Then I play with that little fine tuning button. And that's really the dial in process. So think of that first 6 to 8 week period as let's dial in the station before we move into step 2. And during that initial station dialing in, you're going to experience some of those benefits. But if you want to get into the physiological benefits rather than the neurological or emotional benefits, better muscle building, better, reversal of metabolic syndromes and stuff like that, or bone mineral density, you're going to be looking more into that 6 to 12 month range. But usually that's not what people see as tangible symptom resolution. It's usually how they feel and how they think. And thankfully that tends to come first. So I would say 4 to 6 weeks is usually when we start to hear of improvements.